Good morning, and welcome to Dr. Murphy's Public Health for You series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing great. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, December 12th, and we welcome any questions or comments down below or any of our social media linked in the description. Starting today with a massive study out of France on the COVID vaccine and its efficacy. Can you break down the data for us, Dr. Murphy?
Yes, some very interesting data from the country of France, which has a great medical system, and the system is completely centralized for everybody in the country. So they have data on every single person, all right? Health data. Well, all kinds of data, but we're talking about health data. So they looked at 28 million adults aged 18 to 59. And they found that there was no increase in all-cause mortality up to 4 years following COVID vaccination. You hear all this stuff about, oh, the vaccine's causing deaths later on. There's 10 cases here and whatever. There is no such increase in the French system. Using their data system, 22.7 million adults with at least one COVID vaccine were compared to 5.9 million unvaccinated adults. After weighing for the demographic factors and underlying health conditions, the researchers found that the vaccinated adults had a 74% lower risk of death from COVID and a 24% lower risk of all-cause mortality, no matter what. Because you remember, if you reduce COVID, keep in mind that if you get COVID, there's all sorts of cardiac problems and other problems. It's very well documented. And so when you reduce COVID, you reduce all these long-term cardiac side effects, in particular cardiac side effects. And this, I mean, it's just amazing how powerful this data is because we're talking millions and millions of people. The mortality overall was 29% lower within 6 months for vaccinated adults. I mean, it's just an incredible data set that people should keep in mind if they're worried about taking the vaccine. If they don't take the vaccine, they should worry about premature mortality.
Absolutely. And it's a little funny there saying at least 4 years, but that's because the COVID vaccine came out in 2021. So we've only
Right.
had 4 years to study
We
it.
only had 4 years to study it.
Now, keeping on the respiratory illnesses, but this time looking at the seasonal flu. We've been talking about the concerns over here, but there's also concerns overseas in the UK where they're experiencing similar seasonal flu. Can you tell us about it?
Yeah, I know the UK is following along with us. So what this year is unique for two reasons. One, it's a different strain of flu than we expected, H3N2, which is a more severe form of the flu. And it came earlier than expected. It should be starting like about now, but it's already been going on for over a month. So already this week was up 7% from the prior week. There's been nearly 2 million cases already, 19,000 hospitalizations to date, and 730 flu-related deaths already this season, and the season is just starting. The English have reported basically the same thing. So blues here. It's not too late to get the vaccine. You should get it. It will help you.
Mhm. And on that vaccine train, new news this week about the measles outbreak, the biggest increase in cases we've seen in a while. Can you tell us about it?
Well, we keep reporting this every week. And like I said, it's not going away. It's not going away because the vaccine rate is dropping. And that means everybody who's unvaccinated for measles is going to get measles at some particular point. So this week we had another 84 new cases. The total is over 1,900 cases in the country so far, with 218 hospitalizations and 3 deaths compared to unvaccinated people. Most of the people are unvaccinated that are in the hospital and dying. So currently, there's a big new outbreak in South Carolina, but there's also going on the Utah-Arizona border, as it was before. And it's just it it's not going to go away. We're just going to keep reporting more and more measles. Measles not going away. Canada too. They have a very matter of fact, they have a worse situation than we do. Not really quite sure why that is. They have three times as many cases, and they have, just a little over 10 to 15% of the population that we have.
Yeah, really, really scary. Lots of measles this year. Make sure
Mhm.
you are up to date on that vaccination.
Mhm.
And while we're on the topic of vaccinations, big story from last week was the Advisory Committee on Immunization Practices changing the long-standing hepatitis B vaccine recommendation. Now we've had reactions from the experts, the professional groups. Can you tell us what they've been?
Yeah, this is really sad. There used to be tens of thousands of cases of hepatitis B every year, and this went down when the vaccine became available. And it can be spread mother to child unknowingly if the women are not checked. But even if they are checked during their pregnancy, a lot of them get hepatitis B after they have their test. They don't have the test at all, or they don't have any prenatal care at all. About 3% of women just show up and not deliver a baby. So the what had been in practice until a week ago was that every baby born got a hepatitis B vaccine at birth. And the number of new cases plummeted from many, many thousands of cases per year to 20, just 20. So, why is this important? Well, if you get hepatitis B as a kid, this can result later in life to cirrhosis, severe liver disease, hospitalization, very expensive treatment, and whatever, and liver cancer and death. So so what they did was they said you can't give it to the baby when they're born, but you can give it 2 months later. So in that 2 months, the um, the experts are saying that you've got about 1,400 cases per year will will get it, and that translates to 300 additional liver cancer cases per year, 480 preventable deaths, and $220 million. So the experts, the real experts, people trained in infectious diseases that follow science, um, include the following: the American Academy of Pediatrics, which is based in the Chicago area, the Infectious Disease Society of America, the American College of Obstetricians and Gynecologists, the American College of Physicians, the Center for Infectious Disease Research and Policy, and many hospitals, including Lurie Hospital in Chicago and others. They've all spoken against this new recommendation and recommend that children get it at birth like they always have to keep these numbers in check. So these are real experts, people who have devoted their life, studied the disease, virologists, epidemiologists, pediatricians, OB-GYN. I mean, everyone. I mean, everybody is against this. All the experts are against these quacks that are in the ACIP now and the CDC. Very unfortunate.
Mhm.
Very, very.
Very unfortunate. And another preventative treatment that we followed from its clinical stage to being used and now its second year on the market, RSV preventative drugs for infants, extremely effective and have been shown to be safe. They may be the next target for the ACIP and regulators. Can you tell us what this drug has done and why they might be under attack?
Yeah, so RSV stands for respiratory syncytial virus. It can be very deadly in adults, older adults, particularly over 60 or 70 years of age, or anybody with an immunocompromised condition. But it's also very susceptible to very young children under 2 years, particularly under 1 year of age. It's the leading cause of hospitalization for children under 2 years of age in the United States, resulting in 58 to 80,000 uh, hospital admissions. And if you look around, they're so good at pediatrics now that, the many pediatric wards have closed because there's just not enough pediatric patients in the hospital. They stay safe because all these diseases are being prevented. But RSV was not one of them until this new treatment came out, and there's a vaccine for older people as well to keep them out. There's another 10,000 people can die from RSV every year, and that season is starting right now too. And there's a vaccine for them. But let's stick here with the children. So to the children, what they're talking about here is actually has nothing to do with vaccines. It's a monoclonal antibody. So there's over 100 monoclonal antibodies to treat a variety of very severe diseases. This is a preventative monoclonal antibody that will prevent RSV. It works amazingly well, 80 to 90% effective in keeping these kids out of the hospital and safe, and eliminating, working to eliminate these 100 to 300 child deaths per year. So it was actually so popular when it was launched. They completely miscalculated how many people, how many mothers wanted this for, and fathers wanted this for their kid, and they were running out of it. They didn't have enough. There's another way to do this, and that's to give the mother in a third trimester the vaccine, and she will make the antibody against RSV, and and will pass to the baby, and it does fine. So the mother doesn't get it; she's not really at risk for getting too sick, but it passes on to the baby. So that's another way you can deal with this RSV problem. So now we have our quacky experts saying they're looking at this seriously because they I don't know, they want to make people sick again, and it's just another set of craziness in the world that who wants to not prevent the leading cause of hospitalization in children. Come on. But anyway, it's just another thing that's going on, and we have a treatment that works, preventative treatment that works, and we have a vaccine that works, particularly for older people and pregnant women.
Yeah, it's really mind-boggling when you think about
Mhm.
the sickest of the sickest infants. This is who that's helping. So crazy news. We will follow that. And I'd like to thank you, Dr. Murphy, for your expertise bringing all this to light. Very important. And thank you.
Well, thank you. Have a great weekend. Stay
Thank you.
warm.
Will do. Thank you all for joining us as well for this week's episode of Ask Dr. Murphy. As always, any questions or comments down below, and we'll see you next week. Stay warm.